Welcome to Session 5, Keys to Health Programs from Stripe Community Medical Group. This is Timmy Augustine, the educator. This Session 5 focuses on moving those muscles. Today's topic introduces physical activity. Our goal is to slowly increase activity to 150 minutes per week, but today's discussion will be pretty broad just to get us started. Again, as part of our review of the last session, going to be dealing also with the MyPlate model, which was discussed on Session 4. Some few session reminders. You guys are attending the online webinar. Make sure that after viewing this webinar on YouTube, you will have to complete the post-class assessment at SurveyMonkey by reporting your weight and also the number of minutes that you had physical activity. If by any chance that you will not be able to attend the webinar and would like to attend on-site, please let us know by calling 858-499-3511 or emailing us at scmg.k2h@sharp.com. Here are your program goals. You know about this. Remember that the Keys to Health program is a diabetes prevention program, which is actually designed to help prevent or delay type 2 diabetes through lifestyle modification. For you as participants, there are two main goals that is necessary for you to achieve. A weight loss of 7% over the last 6 months and maintaining it throughout the year. And second, working into 150 minutes of moderate physical activity each week. Remember, do not forget to log your weight and the duration of physical activity in minutes for this week. Session 4 was all about healthy eating. It emphasized about the use of MyPlate with the inclusion of the different food groups and also how will it be able to use the MyPlate in your daily life, especially in terms of using the MyPlate to achieve low-fat choices and low-calorie options. Here on Session 5, it gives us an overview of physical activity and exercise. Here are the following learning objectives. To discuss our physical activity goal, we're going to look at why is it important to be having your physical activity. What are the benefits of physical activity? You might want to examine your current level of physical activity and probably explore other ways in which you can be physically active. Create your own personal activity plans for the following week. The goal for this week will be to slowly introduce physical activity and to make sure that we're going to achieve 150 minutes. So for this week, as a starting goal, we will target 60 minutes. If you will, or if you have not been physically active for quite some time. Think about the following questions. What What is it that you enjoy doing that keeps you active? How do you feel about having 60 minutes as a starting place for your physical activity? And remember, it doesn't have to be 60 minutes for the entire day. You could divide it to make sure that you're going to be achieving it for this week. It could be 10 minutes a day for 6 days, or 15 minutes for 4 days a week, or 30 minutes twice a week, whatever works for your lifestyle and for your busy schedule. This is our goal, is to have at least 150 minutes, of physical activity every week. Better if it's beyond, but the minimum should be at least 150 minutes. Again, as I told you, for this week, we might want to consider easing into 60 minutes as a starting point. What are the activities that you like? Think about, it could be gardening, it could be bowling, it could be Pilates, Tai Chi, kayaking, dancing, swimming, chair exercises, line dancing, TheraBands, or other things which you will find enjoyable and you're gonna be sticking to it. Choose moderate kinds of activities such as brisk walking, and mind you that brisk walking means walking fast enough to breathe heavier than usual, but not so fast that you can't carry on a conversation. And also, you should be able to spread the weekly total over 3 or 4 more days a week. Why physical activity is important? There are a lot of benefits for physical activity. The list goes on by improving your muscle tone and reducing body fat, strengthening your heart, lung, bones, and muscles, making your joints more flexible, reducing back pain and injuries. Overall, it's going to be improving your health, especially for your heart and your cardiovascular system, by lowering your risk for heart disease and certain kinds of cancer, raising your HDL cholesterol, your good type of cholesterol, high-density lipoprotein, and lowering your triglyceride levels. Also, is going to be lowering your blood pressure. Other things, other benefits of physical activity is going to improve your general well-being, helping you lose weight and keeping it off, which is actually the main goal, as I said at the start of the program. Improving your mood and self-esteem, psychological benefits such as countering depression and anxiety, because remember, whenever you do physical activity, it means that the body or your brain secretes endorphins or happy hormones that will actually be good mood improvement. You're going to see a mood improvement, and of course, making you more happy and more positive, giving you more energy, helping to reduce stress, and helping you be able to sleep better. And of course, on an overall sense, physical activity will help you tolerate more activities of the daily living, such as climbing stairs, carrying groceries, and probably playing with your children or grandchildren. What does being physically active give you? Again, I could not overemphasize the benefit by reducing the risk for type 2 diabetes, in which it will lower your blood sugar. Your body will be able to be more sensitive to insulin, and therefore, the body will be able to utilize your glucose and your insulin more efficiently. Think about how much have you been getting every week of physical activity? What is your current physical activity level? Can you think of other benefits to exercising? Probably it's going to help you relax and spend time with your friend and improve relationships and keep us on track. Remember, you have to start slow and increase slowly. Probably you'll be thinking, what do I need? Of course, you need your exercise gear or your workout gear. Socks, we begin with socks. Of course, cotton is best, and we're going to be looking at shoes, your workout shoes. You should be thinking of two things, comfort and safety. It should be comfortable right away. It should be at least safe to wear, and the heel should not pinch or slip when walking. Make sure you're using an appropriate footwear because different activities would require footwear, golf, basketball, training shoes. You might be looking at, it could be just running shoes, or it could be for soccer or for other things. And you want to make sure, again, two things, safety and comfort. These are some resources that you could use to have your workout. Daily Burn contains a lot of resources, videos, which could you actually use for your exercise or your workout. You could just Google Daily Burn. Other workout resources which you guys could use at home will be, of course, your Best Health Fitness Blender, Sweaty Betty. A lot of resources that also contain nutrition and fitness information. I could not overemphasize the importance of physical activity in our program, in our achievement of our goals. Therefore, our session 5 dealt with the following. We discussed about many benefits of being physically active. The starting goal for us will be 60 minutes a week, and you're encouraged to record your current level of activity and decide how much activity you will do each week, what type, and for how long you're going to be active. Again, you might want to spread the 60 minutes goal if you have not been exercising or physically active. If you have been making or targeting and doing your 150 minutes, that will be better. Also, as a reminder, if you have not been physically active for quite some time, make sure that you have this conversation with your doctor prior to starting any physical exercise or activity routine that you want to do. Safety is very important for us. There are a lot of resources that I've mentioned that could be a starting point that you could utilize in order for you to become physically active. Lastly, I wanted to emphasize tracking, and you might have a lot of things or apps that you use to record your physical activity. Tracking is very important to meet our goal of 150 minutes a week. Now, let's try to look into our plan for the next session. What activity will I choose? What days are best for this activity? How long will I do this activity? You should be looking into an activity that you actually enjoy. Will I be having somebody to share with this activity? Accountability is important, and being able to share it with somebody helps a lot to stick with that chosen physical activity that you have looked into. How and where will I track this activity? Am I going to use your tracker, your pedometer, your phone are going to be just using pen and paper to manually log everything. And of course, lastly, how will I fit this physical activity exercises on those very busy days, on those hectic schedule, despite all of your work and other responsibilities at home? For the next sessions, there are 16 sessions for the intensive core series, 6 post-core maintenance sessions. The sessions are available by webinar or attendance in person. Let us know what your preferences are by contacting us at 858-499-3511 or sending an email to us at scmg.k2h@sharp.com. Do not forget the post-class assessment after viewing this webinar, and make sure you log your weight and the number of physical activity minutes that you had for the entire week. We are here to help you reach your goals. Again, my name is Timmy Agustin, the educator for the Keys to Health program, Sharp Community Medical Group. Thank you.